So how do you define success with an Ehlers-Danlos patient or a hypermobile spectrum disorder patient is really getting the patient to be independent at managing their condition. It's not that we're going to find a cure necessarily, although research might help that in the future, especially for those that do have a genetic difference in their connective tissue. It's going to be about managing the way that the connective tissue impacts the life of the patient and doing that from multiple standpoints. So not just joint protection, but immune support, gut support, autonomic nervous system support, and knowing when to go seek resources and who to go see for the right help. So getting someone to know what to do. Most patients are going to be on a home program for the rest of their lives. They're going to have to practice engaging their stabilizing muscles and practice calming down some of the guarding that tends to happen in the body when the joint starts to move too much. Practicing correct movement mechanics. So it's about managing and learning to manage is really how I define success with my patients. But for me, some of the biggest successes have been when someone really feels hopeless, feels like there's nothing left for me except for being disabled. I can't move, I can't do anything, everything hurts. I'm so tired, I can't function, and getting that person able to manage so effectively that they actually feel like, gosh, there's a lot of things I can do and contribute in this world with. So for me, that's the huge success on the other end of the spectrum. But the small successes are like the patients successfully managing their own alignment. They're successfully managing their own muscle firing. They're handling their own gut function. They're not having to go to the emergency room for terrible pains. They know what to do to help themselves. So it really brings the stress level down for the patient, gives them a sense of empowerment and control in their lives, which gives such a sense of positive for the patient. It's somewhat frustrating for me as a therapist. Our outcomes measures are measuring, like, do you ever have pain that limits you in doing the following? Well, yes, we're still going to have that. So our outcomes measures don't show a huge change in function necessarily, but the patient can do it without pain, or they can do it to a greater extent. They know what to do if they get into pain, and that improves the quality of life to such a high extent that oftentimes I get the most grateful patient is the one that has hypermobility spectrum disorder or Ehlers-Danlos syndrome, because they've learned to help themselves. They know how to live again. But their outcomes measure doesn't show the change as much as I'd like to see it, as much as the quality of life score would really show a change in quality of life.